On behalf of the Board of Trustees of the University of New England, it's my great pleasure to present 2019 Deborah Morton Society Award recipient, Elizabeth McLellan.
Thank you. Thank you, Story. Elizabeth McLellan is president and founder of Partners for World Health, an organization dedicated to improving healthcare around the world by implementing changes to the medical supply chain. Dedicated volunteers build collaborative partnerships within healthcare industries, both in the United States and abroad, to develop a system for recycling and redistributing discarded medical supplies to places in need. As the only organization of its kind in New England, Partners for World Health has created a cost savings for healthcare facilities by lowering disposal fees and limiting unnecessary waste. As of 2018, Partners for World Health has prevented a major impact on our environment and redirected over 1 million pounds of discarded medical supplies from landfills to countries in Africa, Southeast Asia, and South America. In addition, McLellan organizes 6 global health medical missions per year to provide education and training to healthcare workers with a focus on improving the standard of practice. The Partners for World Health accomplishes its mission with a workforce of over 800 volunteers. As an active member of the Portland community, McLellan has held board memberships and leadership positions for organizations such as the World Affairs Council, Portland Ovations, Maine Historical Society, and Learning Works. McLellan fulfills her belief that we all need to make a commitment to do something greater than our own interests, and that if we all did this, we would have a major impact on our country and our world. Please.
Thank you. Thank you. I want to thank the UNE Board of Trustees and the Deborah Morton Society for bestowing this prestigious award on me. I am most humbled to be included in the society among so many great women, some of whom have offered me mentorship over the years, and others for whom I call my friends. It is an honor to be here. As the past several years of my life have unfolded, I think about how fate has played a role in determining my path. I recognize that I came from a privileged upbringing and had the best parents who taught me the difference between right and wrong and how to be kind, and educational opportunities that opened doors to my future and new roads to explore. All of this and more brought me to where I am today, but there was really no true plan in this process. I did not write it down. I did not follow the steps. I just continued to walk forward, stepping over obstacles and many bumps along the way, remaining positive and walking down the road and never looking back. This unstructured path that was circuitous at best has offered me opportunities and experiences I never could have imagined and has brought me where I am today. And so as I begin, I want to tell you a story. On one of my many travels to Bangladesh, I was on a busy street meandering through back roads headed to a hospital while horns were honking loudly, demanding their share of the road, all caught up in a traffic jam. It was a hot morning, and the sights and smells of poverty were everywhere. And on one of those muddy black slums, about muddy black streets in the slums in Dhaka, I saw her. She was motionless. Her head was bent, her hands were clasped, as though she was asleep on the side of the road. Many people were walking past her without acknowledgement on their own road for life. Those memories remain as I recall, now years gone by. Her hair was matted, her clothes were tattered, her skin was wrinkled and weather-beaten, with her life etched upon her face. She was disheveled, and she had been living on the street for a long time. Who knew when she had had her last meal or slept in a bed? The woman was nameless. She was faceless. She was voiceless. and that woman has become my inspiration. I have had the opportunity to work in the Middle East, which opened doors to other countries and struggles so many people in our world. And there are many instances, not just one, when I have found myself on the back road in Sri Lanka or Pakistan or Senegal, visiting patients, absorbing the pain and the hurt and the disbelief in their eyes that their lives could ever be so challenging. And I would step back to watch this unfold as I leaned back against the wall in awe, stunned by the helplessness of so many and the inaction of so many more in our world who did nothing to lessen the suffering. And as I watched this unfold, I was a bit overwhelmed, wondering, where do I even start? What do I do? Do I change the bandage on a bleeding patient? Do I hold the crying child who was looking for her mother? Do I help the family lift the father from the floor to the bed? Or do I offer comfort to those who know that their spouse has died? And so as I look back on those moments in my life, so far away from the idyllic Camden, Maine, where I grew up, and realize that my life's course, the life that had no plan, has been inspired by the tragedies in our world that we never seem to be able to fix. And I am haunted sometimes by the world's indifference. I have traveled the world for the past 30 years to places like the gutters in Sri Lanka and hospitals in northern Pakistan, to Kolkata, where the lepers live on the side of the railroad track, to the dumps in Cambodia and even war-torn Libya, to the slums of Bangladesh and Ethiopia and fields in Burundi where women cut down trees for firewood and then they carry it on their backs for 5 miles on their way home, and hospitals where people are so sick, lacking medication and dressing supplies to change wounds not once a day, but once a week, to where you feel what it is like to have no hope. Travels where you see the destruction of life, sadness and malnutrition, filth and so much poverty, and illnesses that you see. It is not the hearts, it is not the deformities or the illnesses that you see, but it is the broken hearts and the broken spirits, the lost souls, the despair and the disbelief in people's eyes that life could ever be so bad. It is not easy to look into the eyes of no hope. But if we are to make a difference in our country and in our world, we need to do just that. Let them inspire us to get involved in making our world a better place to live. Let them teach us about gratitude and what it is like to make a commitment to something greater than our own self-interest. We can make a huge difference in our world and have a major impact if we let them into our minds and into our hearts, because somewhere on the back streets in the slums of Dhaka, Bangladesh, or any country for that matter, is a poor homeless woman sitting all alone on the sidewalk. And she does have a name, and she does have a face, and she does have a voice. Thank you.